Okay, I might get started, seeing we've got on to about just after 1 o'clock and the start time was 1, so we want to keep being prompt. Look, I'd like to introduce myself, Wendy Keech. I'm the Executive Director of Health Translation SA, and I'm really pleased to be here today to talk to you about the Catalyst Grant Scheme and to launch it for 2024. It's terrific to be able to have quite a lot of people who've signed up for today and to be able to be sharing it all with them. And so I'll get going. I know there's people joining as we speak, so I'll just let that happen. Now, firstly, it's not moving on. It's not. Oh, here we go. No problem. Okay, firstly, I'd like to acknowledge we're meeting on the land of the Kaurna people, or I am anyway, and maybe there's other people who are around South Australia on other traditional lands. But I'd like to acknowledge the Kaurna people as a cultural, spiritual, physical and emotional connection to their land, and also to honour and pay respects to the Kaurna elders, both past, present and emerging, and to just recognise the important work that's been done across the state to actually try and reduce the gap for Aboriginal people. So I'd now like to move on to providing some more information about the Catalyst Grant Scheme for 2024. In the presentation today, I'd like to give you a little bit of an overview about Health Translation SA, our funding partners for this scheme, and also the parameters for the funding for this scheme, and then some information about how it's going to work and what you need to do to actually be part of it. If you've got any questions, please don't hesitate to put them into the Q&A section of the webinar, and we will try to answer those as we go through, answer them at the end. But what we also are doing is creating a Q&A page for you to be able to look at. For you to be able to look at, for you to, excuse me, so that we will have that online for later on. So look, let's get started with the presentation proper. And as I said, please don't hesitate to put questions in the question area. So for Health Translation SA, our vision is around research, action and impact. So we're really committed to making a difference for South Australia. We are an NHMRC accredited research translation centre, and we have 11 committed and active partners. And you can see them, our partners, along the bottom of the bottom ribbon of the screen. And importantly, you need to be affiliated with one of those partners to be part of this scheme. So I would encourage you to have a look closely there and take that into consideration. Our purpose is to accelerate research findings into healthcare practice and policy and increase whole of system research translation capacity to improve the health of all South Australians. And this is our purpose and what's really guiding the work we do. And we also work as an independent catalyst and broker to mobilise collaborations that address these major health challenges across the state. So we're really working to bring people together, to bridge silos and to really make a difference across the state. The way we work is by, as I said, this independent catalyst and broker. And you can see on the screen now, we look to health services, researchers, other stakeholders, education and training groups. We think about policy a lot, and also obviously consumers and the community. So we're trying to bring them all together to make sense of the research world and work out what can actually be put into practice to make that difference I was mentioning. So let me move on now to the Catalyst Grant Scheme. This year, we're lucky enough to have the Hospital Research Foundation Group, the Women's and Children's Foundation and the Cancer Council all being co-funders in this visionary program that we've created. The aim is to focus on South Australia's effort around the MRFF principles and priorities and improve the success of the South Australian-led MRFF grant applications. So this is really honing in on that MRFF success and trying to position South Australia for more success. We're really trying to develop that pipeline of health service-led collaborative research projects that address health system needs in South Australia. So our effort is focused, and it is around the MRFF, but what we've learned from last year's is that people are also using these collaborations to look at other collaborative schemes. The NHMRC increasingly have their partnership schemes, the ARC and other grants are thinking about how they build collaborations. And it's not just collaborations within South Australia, it's collaborations across Australia and potentially internationally. So the background, we launched it in 2023, and it was designed by HTSA and a collaborative advisory group. So right from the get-go, we started bringing in funders, experts, people that were connected to the MRFF and consumers to help design what this collaborative grant scheme was going to look like. And that, as I said, we did one round in 2023, and now in 2024, we've got the 3 funding partners, with the Hospital Research Foundation having putting in a total of $240,000, the Women's and Children's Hospital Foundation putting in $120,000, and the Cancer Council of South Australia putting in $120,000. Now, projects that are funded through this scheme can be awarded to anything between $20,000 and $60,000 per project, and importantly, the completion needs to be within the 12-month period. So the Catalyst grant, let me just go into a bit more detail about the scheme itself. It's targeting funding to develop or refine research projects. So it's about doing the work to get things ready to put in that application. And initially, it's about a priority unmet health or healthcare need that's of importance to the health system. Those words are important. It's of importance to the health system because we do this health service desirability check to make sure that your project is not just an outlier idea, but it's something that actually matters to the health system. So what we're looking for, those unmet healthcare needs, and then that the system really believes is important. And they also need to be aligned with the MRFF principles and priorities. And the MRFF are doing a much better job, or doing a good job now, in really articulating their principles and priorities. So what applicants need to do is actually have a good look at those principles and priorities and really be positioning their projects to align with those. Because while they might meet South Australian needs, and if they don't meet their MRFF principles and priorities, they're not going to get through the system or through our scrutiny. As I've said already, the projects need to be completed within 12 months of project completion. And one of the key differences in this scheme is that they have to build cross-institutional collaborations. So it can't just be something that's sitting within one institution. It has to be, and I'll go into that in a little more detail in a moment. It needs to involve end users, being either consumers or clinicians, but hopefully both. So consumers and clinicians need to be on the team, and we need to support a diverse team. So we're really keen to make sure there are early and mid-career researchers involved in teams. And we want to support SA leadership to have the vision to have impact and scale beyond SA. So yes, we want SA leadership, but we want people to be thinking how can they connect with people outside of our borders. So the Catalyst grant scheme for 2024 is a little different for 2023. So if you were an applicant last year, great, welcome back. But what we want you to do is have a good look at the guidelines this year, because it is different. We've got 3 streams this year. The first one is around, this is the Hospital Research Foundation area. It's around chronic conditions, preventative health for priority populations. And it needs to address modifiable risk factors to improve health outcomes. There's a bit more information in the guidelines about this, but it's really focusing on preventative health for priority populations. And so you need to be thinking carefully when you're putting in an application in that stream. The second stream is around maternal and paediatric health and wellbeing, and this one's funded by the Women's and Children's Foundation, and it will support projects that address maternal or paediatric health and wellbeing, where maternal health and wellbeing includes issues relating to fertility, pregnancy, childbirth, and the postnatal period. Now, it is the Women's and Children's Foundation, but we've got criteria around how it connects to the Women's and Children's Hospital, but they can come, the leadership can be across the state. So we'll look at those guidelines carefully, because you need to be able to tick the boxes that have been helped to articulate from the Women's and Children's Foundation. And thirdly, our new stream, and we really welcome the Cancer Council into the program. It's funding provided by the Cancer Council that will support projects that address bowel, breast, or gynecological cancers. Just those three. So we want you to be thinking carefully about those three things, and so they tick those boxes, plus they tick all the other boxes that we're going to tell you about and that the guidelines articulate. Now, there is a chance that your project may tick all three boxes. That's fine, but you're going to need to be able to tell us that story in your application, and then you could well be eligible for all three. However, we will ask you to put a preference in about which one your first preference is. But again, this will be clearly spelled out in the guidelines. So why is this program needed in South Australia? So prior to 2023, we did a good bit of homework across the state to really look at what was available and what was happening and what was our success rate in the MRFF. And we really identified that we needed to build a pipeline of health service-based projects or health system-based projects that researchers could look at the MRFF and other big grants and really look at how they could work. We also identified that we needed to improve the rates of translation of research into practice through connecting researchers and health services who can then work together at scale. So the first one was about building the pipeline. The next one was about connecting people and thinking about how you do things at scale. The third area we identified was current seed grant schemes are quite siloed, and we looked at the ones that were offered across the health services and also across the university sector, and most of them are funding are fairly individually focused, or that's how they end up operating. And so what we thought that was a real niche for something that actually prioritized collaboration. So it actually said it matters if you're talking across the state and interstate, but it matters about that across state collaboration. We identified that we needed to support the retention of EMCRs in South Australia, and we also talked to our flagship projects, and we have 6 flagship areas in South Australia, and they said that they would really value this type of funding. And finally, we were quite clear that we felt that South Australia needed to collaborate and not compete against each other in terms of the institutions, that we were small, and by actually joining together, we could be nationally and internationally competitive. So in 2023, we ran the first round. We had 6 exceptional projects that got through to the end and were awarded the first 6 Catalyst grants. We had a terrific presentation event where we had a panel that talked about the benefits of being involved in this sort of scheme. And in fact, some of them were talking about the benefits from building these collaborations that had already come to light. Not just about this grant, but other things that working together was already starting to achieve. And we were really thrilled with that. And that information is available, and we're happy to share that with you. So it was a great outcome. As I said, the 6 projects, they're all quite different, but they all ticked all the boxes and rose to the top. We've recently done a Catalyst grant. There's a bunch of promotional stuff that's around, which you'll see if you go onto the website page. So some of our project teams have said some of the comments you can see up there. Dr. Sarah Hunter from Flinders University said this grant really does feel like a springboard to bigger and more exciting ways to work together to make a difference in the lives of South Australian families. Tracy Wade, also from Flinders, said, we've deepened our partnership with the Women's and Children's Hospital as we work on this grant, and the process has given us valuable feedback for what would work for an MRFF submission in the childhood eating disorders area. And Paul Worley, Professor Paul Worley's out at Riverland Murray Coorong, he said this Catalyst grant enabled us to think about solving the problems of ensuring people don't fall through the gaps when receiving mental health support. And we thought about it in a different way. So it was really interesting to see that this really was a way for people to start thinking and thinking differently. So let me now move into the nuts and bolts of the scheme. If people were involved last year, it is fairly well, we haven't changed too much because there wasn't too much to change. Things worked really well, but I will go through it step by step. So the objectives, and I've already touched on a number of these things, is to increase the number of successful SA-led applications to the MRFF. Now, we can't make things be successful. We can set people up for success, but the idea of this grant is that every single one of those 6 projects from 2023 or the ones from this year will have to submit an application to the MRFF within 12 months of their project completion. Now, that is the measure of success that we have talked to our funders about, and we're really specific about that. We can't make sure you win that MRFF, but we can really give you guidance to say the expectation is that you will put in an application to the MRFF within 12 months. It doesn't mean that it's exactly about this project. It could be using this as a pilot or a bridging piece to go to something else, but you are actually actively using this as a springboard into the MRFF. The objectives support translational research projects that address unmet need, as I've said. They foster the formation of diverse collaborations across multiple health services and health research organisations, and they build a pipeline for MRFF-ready projects. Eligibility. Now, this is important, and we really want people to take a note of this, because as you a bit later in the presentation, you'll see that if you don't do these things, you don't get past stage 1. You really have to comply with the administrative requirements. All good research groups know that, but I just stress the importance of it because you will get tossed out at the start if you haven't done it. So the administering institution must be an HTSA partner. The principal lead must hold a salary. So this is the principal lead must hold a salaried position with one of the administering institutions. Important that it's a salaried position, and we do check these things. The principal lead is only listed as the principal lead on one application to this scheme, and the application must include a minimum of, can include a maximum of up to 10 members, of which 5 make up the core team, and one of these is the designated principal lead. So that's pretty traditional, but we're being quite specific, and you'll see in a moment about who makes up that core team. And also, as I mentioned, that the project can be delivered within 1 year of commencement. So the team structure. As I said, 10 members, of which 5 make up the core team. In that core team must be team members from 2 different health service organisations, of which at least 1 must be based in South Australia. So what's a health service organisation? The definitions are in the guidelines. They come straight from the Australian Commission on Quality and Safety in Healthcare. And what we're saying is we want 2 different ones. So that could be a general practice and a hospital. It could be Carlin in a general practice. It could be a dental surgery, or it could be 2 local health networks. It could be whatever you consider, but they have to be constituted as a health service organisation. Team members in the second dot point have to be from 2 academic research organisations or medical research institutes. So there can't be 2 people from SAMRI or 2 people from Flinders. They have to be 1 from Flinders and 1 from SAMRI, or 1 from Adelaide Uni and 1 from Uni SA at this point in time for 2024 anyway. So, we're on this. Make sure we're on the same page. We've got 2 different health organisations and 2 different academic organisations, and then there must be a health consumer or community representative. And you can see through this when you just pop someone on who's already in a team, and it's just convenient. We want genuine consumer participation in this project. So one of the team members must be designated the principal lead, as I've mentioned, and there is no requirement as to the other roles of the remainder project team members. However, the diversity that you can represent in there is part of what we're looking for, and the inclusion of the EMCRs is something that's highly desirable. So we really encourage you to think carefully. Now, some of the teams in 2023 were really great, and they obviously had thought about private hospitals, they'd thought about insurance companies, they'd thought about people from different diverse backgrounds. I think we had some from migrant resources, so there was really interesting stuff came about from people thinking outside the box. I mentioned the definitions. As I said, the definitions are all there in the guidelines. And so I just encourage you to have a good look at what we've said there. I won't go through that in detail, but just to be sure that you're following the definitions. Finally, for this little section, the types of grants, and it's about strengthening MRFF applications, as I mentioned. The applications must choose to submit either a refinement project or a new project. Now, a refinement project, what does that mean? So it strengthens an existing concept you might have previously done something with. You might have already submitted to an application, to an MRFF application, but you're actually refining it, and that's completely good. We want you to build on work that you've already done. It doesn't have to necessarily be new. However, it could be new work where you design and or pilot a new project or a scale up that you've previously worked with. Now, I've certainly, my research background, it was really valuable to do these pilot projects or to get this data that you could then build your competitive grant on. So I encourage you to think creatively and think about either refinement projects or new projects. Other activity, so that's probably the gist of that. So then when we look at the review, assessment and approval process, once they come into us, as I mentioned, we'll do the eligibility assessment. Once you've got over that hoop, we'll then be thinking about the health service desirability check, where we get people to say, to scrutinise the application to say, does this matter to the health system? And we'll also be looking to our review panel for an evaluation. So this will be the EOIs coming in at this point. So the EOIs will come in and we've got this two-stage process where the EOI comes in, we check it for health service desirability and then for the evaluation, and then we invite people to go to full application. Now, last year, we did have quite a lot of applications, and I think 12 went through to full application, of which 6 were successful. So we worked with our panel, and the panel, importantly, was actually a real mixture of health service, consumers, people with implementation science expertise and research excellence expertise. And it was a mixed bag, was what I'm saying. So don't just assume it's going to be all based on research excellence. We're actually getting people from across the spectrum to really think about that selection criteria. Obviously, we've got clear criteria, but everyone has a bit of a different think about it, don't they? And we found that last year when they're reviewing these grants, but we're really trying to keep it as translatable as possible. So the review process, as I said, administrative and eligibility review, health service desirability check, and then the evaluation by the review panel. The top ranked EOIs will then be shortlisted, and we will really look at, selecting those ones that we think have got the best chance of success to go on to full application. When we review the process, we've got 4 categories that we're actually thinking about. And again, this is all in the guidelines. Unmet health and healthcare need and co-design. We have 30% weighting on that. We have the diversity of collaboration at 20%. Alignment of with MRFF priorities is about 30%. So the importance of that, I can't emphasize that people have to have a good think about how it fits in with what the MRFF are wanting and how it's MRFF ready. And then feasibilities at 20%. You'll see also from there that some of these we assess at full application and some at the EOI stage. And in the guidelines, we've got a set of questions that will be translated straight to the reviewers around the criteria. So all of those questions are things that you need to make sure you answer in your applications, especially if you get to full application level. But in the EOI, make sure that you're responding to what you're getting asked. Other considerations. The projects must commence within 6 weeks of the formal date of offer. So what we're trying to do is have this as a rapid process that people can get off and do, and then within that 12 months time frame that they're in the position to then finish their project and start thinking about their application. So they must commence within 6 months of the 6 weeks, of the formal date of offer. Ethics must be built into the 12 months duration of the grant. I know that's tricky, but we really expect you to be thinking carefully about that, the ethics process. That the principal lead must respond to all the reporting requirements. And that is really obvious. Now that we're in the swing of to 2023, we actually need those principal leads to be committed to responding as required. Contracts will be arranged by HTSA partner organisations and SAMRI. Health Translation SA actually sits, we're administered by SAMRI, so the contract would be between SAMRI and the partner organisation. And that all happens pretty seamlessly, actually. So that's not usually a hitch, but that's the arrangements. And there will be publicity and acknowledgement requirements from the funders and from HTSA. So we do require people to talk in a particular way about the funding. And so that's, again, nothing different from other grants. So we are now in the position to say that from this, the EOI will open on May the 20th, which is next Monday. The EOI will close on June the 19th. So you'll have 4 weeks to get together your EOI. The invitation for full application will come out at around about the 26th of July, and the full applications will close on the 2nd of September. So you'll have 6 weeks to do those full applications. And the final selection will happen by the end of October. Now, those dates, anyone who was involved last year, you can see we've built in a bit of extra time just to accommodate everyone's feedback, and hopefully that will set a structure that will be a really nice structure for people to be able to come up with these new and or build on existing collaborations and really be in a position to do some great things. So the take-home messages are that this is a bit different. It's catalyst funding, and it's trying to seed and get things happening across health services and research organisations with collaborative projects, which can really be focused on making a difference around what matters to health services. The projects must revolve around health system priorities with involvement of clinicians and consumers. So if you haven't got those people in the tent, you need to work out how to get them in the tent, and then make sure you're listening and learning from clinicians and consumers. Need to align with the MRFF priorities and requirements. There's no doubt about it that that is a crucial part of you being successful. And if you can't tick the boxes of both the funding parties, and I went through those earlier, what the funders need, but also the MRFF. And each of those funders, when they were coming on board, they had a good look at those MRFF requirements, and they could see the alignment. So this is entirely possible. So we really encourage you to think about ticking the boxes of the funding partners and also of the MRFF priorities and requirements. Be the SA lead with potential to scale up. So I guess that's another thing about the MRFF. They really want us to be able to see that we're looking outside of our borders, and that the potential for scale up is there, and that there is impact for the future. And, you know, that's the word we use a lot about impact. But I encourage you to think carefully about how you can position, even if it's a refinement project or a new project, how you can think about it in terms of this has the potential to do whatever. It needs to be completed within 12 months, as I've already mentioned, but in terms of the framing, keep that in mind, because that feasibility question is important and the reviewers are onto it. That includes strong implementation and translation focus. So be thinking about, you know, the difference this is going to make, and also work to extend already established relationships. So sometimes, especially given the timeframes, it opens on Monday and closes 4 weeks later, you may well have existing relationships that you can actually get together instead of starting from scratch. And I obviously encourage you to build on those established relationships. However, you may bring in a few new people here and there. But I guess our message is 1 + 1 hopefully is a lot more than 2 when you're building collaborations. So to take action today, you can download the guidelines The FAQs are up on the website, and we've got a brand new page on the website around this initiative. The EOI form, as I said, will be available on the same site, but from May the 20th, which is next Monday. The FAQs will be updated based on today, so we'll have a look in a moment at what questions might be coming through, and we will update those, and they will be a resource that it will be continually updated when we get questions about it. So, check back in there. But I can't stress enough how you need to use those guidelines to really shape your project. So thank you very much for your thoughts. I'm going to leave this screen up while we just take a moment. Are we able to get into the questions? We'll just have a look at our. I just don't know where that ribbon's gone.
Disappeared. Well, here's some anyway.
Anyway,
with the ones with the asterisks against.
We've got a question here. Can a team member be on more than one application? And so that's a question that's come through. So one of the answer there is yes, as long as they are not the principal lead. Okay, so yes, they can be on more than one application as long as they're not the principal lead. A principal lead can only be listed on one application. I've got another one here. Will this be recorded to view later? Yes, it will. We are recording it. We'll top and tail it and try to get out any of the words that we don't need. No, not really. We will absolutely have it on our website, and we'll let everybody who is on this webinar, and I think we had 150 odd people put their names down. Everyone will get the communique about it to be able to view it. I can see a question there. So if the Hospital Research Foundation are involved, how does this affect IP? They usually take a proportion of the commercial profits in the long term. There is a statement we have in the existing Q&As about that. And the question is, what intellectual property will be requested in this scheme? And the answer is there are no specific IP requirements. Requirements of the funders in relation in the funders and the HTSA in relation to appropriate acknowledgements and publicity will be outlined in the funding agreement, but there is no specific requirements for IP at this stage. So hopefully that helps that question. Let me have a look at the next one. Just confirming whether funds contributed by each of the foundations across the three streams represent the amount of money, amount of funding available per stream. Slightly ambiguous. So yes, the answer is to that one is for the Hospital Research Foundation, there's $240,000 available for that stream. For the Cancer Council, there is $120,000 available for that stream. For the Women's and Children's Foundation, there is $120,000 available for that stream. So it's not ambiguous at all. It is exactly what it says. And just to let you know that they may be or two projects of 60,000, or they may be different machinations of that depending on what applications we get. But as I said at the start, it's between 20,000 and 60,000. The grant is the range. The success rate from 2023 is the next question. Could you tell us the success rate for grants once you make it past the EOI stage? And we actually took 12 applications to full application, and it was a 50% success rate once you got there. And I can't look into my crystal ball and decide what the panel will decide to do, but that at this stage, that is what we did in 2023. Question there is, does two different hospitals from the same SA-based LHN satisfy the requirements for two different health services? And the answer is no. The core team must include two members from different academic research organisations or different health services. So that is part of what we're trying to do. We're trying to get people to look outside their own borders. So that was a decision that was made last year. Next one is, how do you define consumers? Do you mean industry partners only, or is there others? It could be industry partners, but we talk about consumers as people who are health service consumers, and there are definitions in the guidelines and also in the Q&As around health consumer representative, and certainly it is made quite clear. But certainly industry partners would also be welcomed, and many of the applications last year did think about industry partners. I'll just see if there's any more. Yep. Is there a limitation in how many applications you can submit as an AI? No, I think I've already answered that one to say you can be on more than one applications as a AI. It's only the lead, the principal lead can only be on one. We've got one now. The Cancer Council SA is a funding partner. Does that mean the Cancer Council cannot be a collaborator on a project? Good question. We'll ask the Cancer Council how they feel about that. We didn't have that in that rollout last year because our funders were Hospital Research Foundation and the Women's and Children's Foundation, so that was a bit different. Let's take that one on notice, and we will put that into the FAQs about Cancer Council, and we'll have a chat with them about how they would like to play that one out. Does being salaried include contract or sessional staff? Yes, as long as the person is salaried for the duration of the project, was the answer for that one. Can a not-for-profit be involved? Absolutely. They just can't submit the application unless they're one of our partners. But not-for-profits can definitely be involved as part of grants, and we encourage you to do that. You just, if you're not one of our partners, you can't be the project lead. Another one, does Stream 2 include children's and adolescents? Yes, it does. Can funds be used for salary? Yes, they can. Are applicants expected to contribute cash in kind co-funding? Ideally, we definitely would love that. We haven't specified that that's the case, but in almost all of the projects last year, there were significant in-kind contributions from applicants across the board. It's only a small amount of money as a catalyst, funding as a catalyst injection, really, to get things going. So we completely appreciate that there almost must be in-kind contributions for these things to actually work. So the answer is yes. The next one is, will my application be less favourable if we have interstate collaborators, which is a part of the core team? In fact, it's probably the opposite. It'll be almost more favourable if you've got interstate collaborators, because we know MRFF success is not about a project that's sitting inside an institution. The MRFF are always looking for things that cross borders, cross institutions, work with consumers, and think big picture. So if you're actually thinking about how your project intersects with other states, it's very likely that there will be, it'll be seen favourably. Which one am I looking at now? If a CI has a position at both the Women's and Children's and the University of Adelaide and private, can they pick one to fulfil the eligibility criteria? The answer is yes, but be deliberate and make sure you're really clear, and that the rest of your team is also clear about who's what, because we did have a few people that weren't clear about which hat they were wearing, and that causes a bit of administrative headaches for us. So just be clear and make sure your team still fits the brief on what's being asked for. The core project team, the question is, just to confirm, the core project team must include members from 2 different health service organisations, yes, and two members from different academic research organisations, yes. That's exactly right, and a consumer. The core team is 5 people, and it has 2 health service, 2 academic, and a consumer. Yep, I've just answered that one. Just to confirm, 2 different hospitals within, we've answered that one, I think. Then the answer to that, if someone didn't hear it the first time, you need to be thinking outside, across health services. There are already significant funding schemes that help people within their own LHN, which would allow two hospitals to be working together within an LHN. There are other funding streams. There was no funding streams that asked people to go across local health networks. Health Translation SA will never do something if it's just replicating or duplicating something that's already happening. So our point of difference is we're going across local health networks or health services. And health services don't necessarily just have to be local health networks. They could be general practice. They could be other health service groups that are across the community. I think that's probably, so I think we'll just go, this will be our last question. Are Health Translation is able to assist with identifying an appropriate consumer to include as an investigator on these grants? We certainly can have that conversation with you. As many of you will be well aware, Health Translation SA has a register that we promote across the state, which has consumers on it who are interested in working in a space. We also work and we'll put requests out to the register to see if there are consumers who are interested to being involved. We also highly encourage you to think about groups that might align with your topic. They might be, so if it's a cardiac thing, you might go with the Heart Foundation, Cancer Council, you can actually look at other ways to identify consumers that might be interesting. COTA, the Council of the Aging in South Australia, there's a range of different ways to do it, but we're very happy to have that early discussion with you and point you in the right direction. So I think with that, we might wrap it up. We've had quite a few questions, and I think we thought we'd be about a 40 minutes window for this webinar. Hopefully that's super helpful for you to get you started and get you moving towards an application. Let me just see if we can move on a bit. I wanted to really thank our funders, the Hospital Research Foundation Group, the Women's and Children's Foundation Group, and the Cancer Council of South Australia for their contributions to this. I want to also thank the Health Translation SA partners, because our 11 partners are also the funders of this project, because they support us and we do the work to actually make this, bring this together. I also want to mention the Catalyst Advisory Group members. And as I said earlier, we have representatives from across academia, health services and consumers that have helped us construct this scheme. And also we meet regularly to make sure we are taking it down the right track and that people are supportive of this. We also reach out to the MRFF working group and others that have helped us across the state, just to check in to make sure that we're not, talking in the echo chamber of life. We're actually reaching out and checking to make sure our ideas and things are well grounded. And certainly I'm backed by a great Health Translation SA staff team who pull this off. So with that, I think it's probably a good time to stop, just to say that we will send the presentation around to everyone who signed up for this seminar. I encourage you to jump onto the Health Translation SA website, certainly following Monday when the EOI will be up there, and we will continue to communicate with you. I really encourage you to apply. I wish you the best success, and the collaborations that you can make in these early stages where you're starting to get these ideas gelled, checking in with health services to make sure they're on the money and that you're really doing things that matter, and then make sure the right people are around the table right from the start are the ingredients for success that we've seen time and time again in this health translation impact space. So I encourage you to go for it, and we look forward to receiving your EOIs. Thanks very much.